we are live. All right. Hello, everybody. It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. We're here at Plastic Surgery today, and we're going to talk about one of my favorite subjects, one of my favorite topics, something I've been very involved with, which is BBL safety. All right. And what is it that you can do to make a BBL safe? All right. And of course, we know a lot about this because we are the nationwide leader of safe BBLs. All right, Pure Plastic Surgery has done the most ultrasound guided BBLs for one facility of the entire nation, and we've had 0 incidents of fat embolism and 0 BBL deaths. Okay. And we've been very, very involved in developing some of the techniques used to make this procedure safe. Because you know what? I know there's still a lot of news out there in the media. People are still using old data and they're still saying that BBLs are dangerous. Okay? But what they're not, this is old data. This is data from like 2017. Back in the day now, right? Where, yeah, at that point in time, BBLs were dangerous because people were injecting fat into the muscle, and so the mortality rate was 1 in 3,000, okay, which is way too high. But that is not the case today, in 2024. If you go to the right person, if you go to the right facility, okay? So can a BBL be dangerous? Sure, it can be dangerous if you go to the wrong person in the wrong facility. Can a BBL be very, very safe? Yes, a BBL can be very, very safe if you go to the right person and to the right facility. So what are the things that make a BBL safe? So they're broken down here into different categories. You have the surgeon, their technique, the facility where you're getting the procedure done, the volume of cases being done per surgeon, and of course, patient-related as well. All right, so it's broken down into these different categories. And we're going to go over each category as to what boxes you have to check to make sure that you're getting a safe BBL versus a dangerous BBL. Because let's face it, at the end of the day, it doesn't matter how cheap it is, it's not worth your life. Nobody wants to have a dangerous BBL and play Russian roulette and perhaps not make it out and not go home to your kids and your families, right? All right, so what makes a BBL safe? Again, we're the leader in safe BBLs in the entire nation, so we know quite a bit about this subject. So starting with the surgeon. So things that I would check, I would make sure the surgeon is board certified, but not simply board certified, right? The question is board certified in what? You want to make sure that your surgeon is board certified in plastic surgery. That is what matters, okay? Would you, let me ask you this question, right? Would you go to a gynecologist to have open heart surgery? No one in their right mind would ever do that, right? Because you know that then the risk of mortality is going to be very, very high. So why would you go to a gynecologist for your plastic surgery? Why would you go to a pediatrician for your plastic surgery, right? So here we go. So you want to be board certified in the type of procedure you're getting. So you want to be board certified by the American Board of Plastic Surgery. Okay, that's check number 1. Check number 2, of course, their experience. Several studies have shown that those that have done very few numbers of BBLs, and specifically for here, the risk of complications is higher. So the more experience that you have, the lower the risk of complications. This is something that's actually seen across the board for all kind of complex surgeries. So for complex open heart surgery, vascular surgery, for complex abdominal surgery, like for the pancreas or what we call Whipple procedures. Okay, we all know that the more experience the surgeon in the facility has, the lower the complication rates. Okay, so you want to go to a surgeon who's done quite a few BBLs, or at the very least is at a facility where they're trained or they're being supervised by someone who has done a ton of BBLs. So for example, here at Pure Plastic Surgery, we've done over 2,000 ultrasound guided BBLs. Like I said, I myself have done probably about 3,000 BBLs in total, and like I said, close to 2,000 ultrasound guided. So we have a ton of experience here. And then last but not least, you want to make sure, or you want to check to see if your surgeon is part of WAGS, which is the World Association of Gluteal Surgeons. And this association where we make sure that all of our members are following certain guidelines to make sure that they're performing this procedure safely, okay? And if you follow those guidelines, if you do the online test, if you take the live course, and you look at, well, you look at the first actually online test, then the video, then the live course, okay, of which we are here, a training center. So Pure Plastic Surgery is a WAGS training center for ultrasound guided gluteal fat transfer, okay? People come here to learn how to do that, and then you take that course, and then after that, you send us a video demonstrating that you're doing the procedure correctly. If you pass all that, then you obtain the WAGS, or the World Association of Gluteal Surgeons safety seal, okay? So this is mine, of course. Like I said, I've been doing this since way before it became regulations here in Florida. I've been doing ultrasound guided BBLs since 2019, okay? So if you have the safety seal, then the chances are that the surgeon knows all about the procedure, all about the anatomy, all about how to use the ultrasound and make sure that you're getting a safe BBL procedure, okay? So this is very, very important as well, all right? Okay, that's the surgeon. What's next? Well, the technique. So what technique is the surgeon using? Well, of course, I didn't write it down here because by today, 2024, no surgeon anywhere in the world should be putting fat into the muscle, into the gluteal muscle. Gluteal muscle, okay, for BBL. This is the wrong thing to do. This is what increases your risk. That's when people have fat embolisms and and die on the table. All right. So the technique means that you're placing the fat in the subcutaneous space, which is the space between the skin and the muscle. All right. Everyone must be placing the fat in that space. You should not, under any circumstances, place the fat into or deep to the muscle. But by definition, it's a blind procedure. So how do you turn a blind procedure into one where you can see? Well, you use ultrasound imaging or ultrasound guidance, right? So that is now a law here in Florida. It is also a law now in New York, and I'm sure other states are soon going to follow, and other countries are soon going to follow in terms of making it a law. But it is a law here in Florida, and it's also what's recommended by the major societies, such as the American Society of Plastic Surgeons and the Aesthetic Society. All right, so your surgeon should be using ultrasound guidance for this procedure, okay? That is the most important. So the two most important are placing the fat in the subcutaneous place only, never in the muscle, never deep to the muscle. And number two, using ultrasound guidance so you can see that you're actually placing the fat where you're supposed to be placing it in that safe space, okay? There's other things you can do to make it, a little bit safer, which is your entry points. This is my very crude drawing of a buttock, but if you put this incision up here at the top, okay, like just above the kind of, the butt crack, if you will, that one is a safer entry point because it's very tough from there to inadvertently get underneath the muscle and injure the major vessels. So this is the safe one. Now these ones down here, if you're using them only to do the hips, if you're using them only in that direction, that's fairly safe. This one in this direction is fairly safe. Now if you're using this one down here to do the center, then that's where you need the ultrasound guidance, right? So I use all of these. I use this entry point here and these two down here. But when I'm using this entry point down here to give you more projection, whenever I'm placing fat over the gluteal muscle, that's where we're using the ultrasound guidance, okay, to make sure that I'm in that safe space. If we're away from the gluteal muscle into the hip area, you no longer need the ultrasound because it's safe out in the hip area, okay? And if you happen to be, for whatever reason, in a place where you just can't get access to an ultrasound, then my recommendation would be that you do all the fat's going to be placed over the gluteal muscle. You do all of that through this incision up here because that is the safest one to use if you don't have the benefit of the ultrasound, okay, for whatever reason. But really, everyone should be using ultrasound guidance, all right? Next, of course, is the facility. Where are you getting this done, right? It makes a difference. Are you getting it done at a certified facility? Or are you getting it done in someone's kitchen, right? That makes a huge difference. So you want to make sure that the place is certified. Here in Florida, the kind of most baseline level certification is that done by the Department of Health, okay? And so if you need to have that in order to be doing this legally, right? If you don't have Department of Health then that's illegal. That's very, very bad, right? So that's the baseline. But if you're really concerned about patient safety, you're going to take the extra steps, right? You're going to walk the walk, not just talk the talk. You're going to go to the highest level of certification which you could possibly achieve, which is the same level of certification that there is in all major hospitals, tertiary and quaternary care hospitals, which is what's called the Joint Commission, or JCO. All right, and that's the one that we have here at Pure Plastic Surgery, because if you know me, you know I don't just talk the talk, I walk the walk. And so we've done all the extra steps, and it's a lot of them, and it's so that we are certified by the Joint Commission, or JCO. So the Pure Plastic Surgery ORs are all certified by JCO. Okay, of course there's the reputation and complication rates. Historically in the past, typically if you're like a budget high volume center, and there's quite a few of them here in Miami, you're going to know that those places have had several issues and deaths, okay, and they're still running today. So I will definitely look into the reputation and their complication risk or complication rates, okay. Here at Pure Plastic Surgery, we're known as one of the safest, if not the safest clinic down here in South Florida. So our reputation, we stand by our reputation, which has always been safety, always been our number one priority. Okay, and our complication rates are very, very low. And we're coming up to that time. I make these complication rates public, especially specifically regarding the BBL. I do that in December every single year. If you want to go back to my Instagram and look at December, you'll have them for the past 3 or 4 years. And we're going to do that again this December, which is going to be the last live of 2024. Okay. But then last but certainly not least, and this is going to be coming out soon, we're going to be basically creating the outline, the regulations that are needed for a facility to become a center of excellence for BBL and BBL safety. And Pure Plastic Surgery is going to be one of the first facilities that is what's considered a center of excellence. That means that we do enough volume, we have low complication rates, we have high patient satisfaction, we have high certification such as the Joint Commission, and we provide everything that is needed for the patient to have a seamless journey and the lowest complication rates possible, all the way from the beginning to the surgery to post-op care to the very end. Okay, so Pure Plastic Surgery, Center of Excellence for BBL and BBL safety. All right. Okay, that's the facility. Next is the volume. I certainly wouldn't recommend going to someone or a surgeon who does more than 5 BBLs in one day. Actually, even 5 is quite a bit. Of course, I can say, there's some surgeons that are faster than others. Perhaps some a little bit younger, they have a little bit more energy, but certainly no more than 5. All right. I'd probably say, a good average would be 3 BBLs in a day. Okay, maybe up to 5. That's the only thing you're doing. You're not doing any other sort of case that day, but certainly no more than 5 a day. There is such thing as surgeon fatigue, the same way that airline pilots are not allowed to fly for more than 8 hours. A surgeon should not be doing more than 5 BBLs in one day, because that can lead to surgeon fatigue, which can then lead to higher complication rates. Okay? And then last but absolutely certainly not least is patient selection, right? You guys are part of this too, all right? We're not operating on robots, we're operating on people. And people need to make sure that they are healthy and optimized for the procedure, okay? Not everyone is going to be a candidate for a BBL. So who's the most ideal candidate? Well, someone who has a BMI under 30. And if your BMI is maybe up to 33.5 or so, okay, that's okay. Different surgeons have different top or limit BMIs. But certainly I would say anyone that has a BMI of 35 or higher, you're just simply not a candidate for this procedure. It's too risky. The higher the BMI, the higher the risk, which means that you can have complication rates, especially respiratory complication rates. You can have increased risk of blood clots, which can also be deadly, right? You can have a clot in the leg, which is called a deep vein thrombosis, or a clot in the lung, called a pulmonary embolus, and that can land you in the hospital, in the intensive care unit, or even potentially death. So I would not recommend this procedure for anyone who has a BMI of 35 or higher. Certainly, I think 35 is a dead cutoff. But I think it's even better if your BMI is 30 or lower. And if you need to lower your BMI, then talk to your facility. For example, what we do here is that we can provide our patients with Ozempic or Mounjaro to help lose the weight before surgery so you can get into that healthy BMI range. Okay? All right. Patient needs to be healthy, so no active other medical conditions. If you have some medical conditions that are under control, for example, high blood pressure or diabetes or thyroid issues, and those are completely under control and your primary care doctor clears you and all your labs are okay, then yes, we can move forward, okay? But if they're not under control, then we cannot. We can't move forward because, again, it's going to increase your risk profile. There are certain health conditions which are just, they're too risky. Okay, for example, a lot of the autoimmune diseases, scleroderma, things like that. Or if, of course, you have, history of blood clots, clotting disorders in the family, whether you clot too much or you bleed too much, you're not going to be a candidate. If you have sickle cell disease, you're not going to be a candidate. If you have sickle cell trait, then typically it's okay. But if you have sickle cell disease, you're not going to be a candidate. If you have some of the thalassemias and your hemoglobin is you can't get it to 12, then you're not going to be a candidate. All right, so that's another one I should have wrote here, but your hemoglobin needs to be 12 or above. Typically, age should be potentially less than 50 for the most part. Are there some patients over 50? You have to be extremely healthy, like extremely healthy over 50-year-old, like absolutely have no other medical conditions, be BMI certainly under 30, and be extremely tough and strong and healthy. Okay? And super important is, of course, your compliance, right? We need patients to do what they're supposed to do after surgery in order to have good results. One of them being walking. If you have a BBL and all you do is lay around all day, then your risk of blood clots goes up. Again, DVTs and pulmonary embolus, which can land you to deep, deep trouble. Or if you don't take care of self, other complications can go, such as infection or fibrosis or ischemia of the skin, etc. So you have to be able to follow all the rules, right? All the recommendations that your surgeon gives you before, during, and after surgery in order to try to ensure the best outcomes and the lowest complication rates possible. Okay? So here's the good news. Here's the good news. If you are able to check all these boxes, guess what happens? And your surgeon is a WAGS member and your surgeon uses ultrasound, what used to be a mortality rate of 1 in 3,000, which is way too high for a cosmetic procedure, all of a sudden goes all the way down to about 1 in 50,000. You're no longer playing Russian roulette. Okay? And that's why I say that a BBL can be safe if you go to the right surgeon, doing the right technique at the right facility, not doing too much, and the patient is a good candidate and is compliant with their procedure. It's huge. It's a huge decrease in mortality when all these boxes are checked. And that's why everyone should check these boxes first before even looking at price. Okay? Before even looking at price. This is where you need to go. Okay, you need to go to a facility and a surgeon such as this so that you can be in this box here and not in that box there.
Doug, it's time for a screenshot.
Screenshot for that. Yes.
Yes.
This is where you want to be, and I'm happy to answer any questions.
Oh. First of all, I have AFib, AFib.
AFib, yeah.
AFib, okay. But I'm not on any meds. My BMI is 25. I've been cleared. Am I still a candidate?
Yeah, so that's a bit of a difficult question. So AFib, for those of you that might know, is an arrhythmia. The heart has like a flutter so it's called an arrhythmia. It's a very specific type of arrhythmia. And honestly, for doing a procedure in what we call an office-based outpatient surgery setting, you probably wouldn't be a candidate to be doing it in this type of setting if you have true AFib. The reason is because once you undergo general anesthesia, potentially something that can happen where the heart rate goes way too high, and then there can be problems and complications. But again, it can be taken a little bit on a case-by-case basis. I would say in general, AFib will make you not a candidate, but perhaps, your specific type of AFib, if you had clearance from your cardiologist and everything else, it could be something that could be contemplated. But yes, in general, I would say AFib, not a candidate.
How common are infections with a BBL procedure?
Great question. So how common are infections? So if you take the nationwide, the infection rate for BBL is approximately about 10%. Okay? It's a little bit higher than some other surgeries because of the area that is being worked on, which is very near the anal region, which of course has a lot of bacteria and things like that. And so the infection rate for BBL nationwide is about 10%. However, very much kind of like this, the infection rate at Pure is less than 2%. Okay? In fact, last year it was about 1%. So another thing, right? So what you don't want to, again, you can if you go to the right facility, you cannot be in that 10% box and you can be in that 1% box, okay? Why is that? Because of all of the techniques that we use. Before we inject the fat, we re-prep and re-prep the patient. We add antibiotic solutions to the fat. We then clean the cannulas continuously with betadine solutions or alcohol if you're allergic to betadine. Excuse me. And before starting the procedures, we use UV lights to sterilize the room before starting any procedure. So all these things together and combined, and of course using your usual sterile techniques, have lowered our infection rate all the way down to about 1%, certainly less than 2%.
Doug, what's included in a mommy makeover?
So my makeover, great. All right, so my makeover includes a breast surgery and a tummy or tummy tuck. So breast surgery can be any breast surgery. It can be a breast aug, can be a breast lift with implants, breast reduction, okay? And then your tummy tuck is usually a full tummy tuck, but it can be different types as well. But your typical full tummy tuck will involve the skin excision as well as the muscle repair and liposuction to the flanks and the waist. So that's all included in your mommy makeover.
Is it possible to do a reverse tummy tuck during a breast lift? How would that work?
Yeah, you certainly can do that. So, and it's typically, not a bad idea to do it at the same time because you're going to be using essentially the same incision. So if you're doing a breast lift, especially if you're doing one with an anchor type pattern, you're going to have that scar that goes just underneath the breast in that inframammary fold. And that is the same place where you're going to be putting the incision for the reverse tummy tuck. So for those of you who might not know what a reverse tummy tuck is, it means that instead of pulling down this direction with the scar down here, we're pulling up in this direction with the scar underneath the breast. And if it's a fairly, significant reverse tummy tuck, then the scar goes underneath the breast, but it does have to cross the midline. So the scar goes from one side to the other. If it's moderate to mild, sometimes you can just put the scar just underneath the breast without the part that crosses across, through the midline, and therefore there's no scar right in the middle. You can still wear something fairly low cut, and no scar would be visible there.
¿Se puede hacer un BBL con piernas delgadas?
Bueno, se puede hacer, pero el punto es que quieres que quede natural, ¿verdad? Que no se vea como que pusimos ahí, nalgas que no tienen nada que ver con el resto del cuerpo. Entonces hay que buscarlo hacerlo de una manera en cual todos los contornos sean lisos y naturales. Y para hacer eso, no poner demasiada grasa, tener en cuenta cómo son las piernas y poner un poquito de grasita para las áreas de transición para que todo quede bastante liso en esas áreas y no se vea demasiado quirúrgico o demasiado fake.
How long after a BBL can I go back to work?
So it depends on what work you do, but if it's an office-based setting, usually after about 7 to 10 days, it's okay. and you're usually driving around that time as well. Now, if it's going to be something that's kind of, like something more involved, like heavy lifting, strenuous activity, you're like, say, a fire woman or a policewoman, then it's going to be 6 weeks.
How long after my tummy tuck should I wait to get my incision revised? I think I have dog ear on one side.
Dog ears on one side? Okay. So, I mean, it's not too unusual. Of course, we do everything we can to try to avoid dog ears, but sometimes they can pucker out a little bit. What is a dog ear after tummy tuck? It means that towards the end of the incision, sometimes it kind of puckers out a little bit. It can be two causes. One, there's still a little bit of excess skin, or two, there's a little bit of excess fat. I would say you want to wait at least 3 months, anywhere between 3 to 6 months, to make sure that it's a true dog ear before you make that decision. Because sometimes you're going to have a lot of kind of like swelling and inflammation there, and it can kind of look like a dog ear, but with the compression and time over the first 3 months, it can shrink down significantly. So you want to give it a minimum of 3 months, but ideally anywhere between 3 to 6 months.
Can I get a BBL and a tummy tuck at the same time?
I do not recommend that. No, I do not recommend that for multiple reasons. Number one, we're talking about safety, right? You add the tummy tuck to the BBL, all of a sudden the risk profile goes way up. All of a sudden you're not here anymore. Okay, now you're kind of down here somewhere. Okay, the risk profiles goes up. The risk of bleeding goes up. The risk of infection goes up. The risk of blood clots goes significantly up. Okay, it's just not worth it. Number two, recovery is going to be terrible, right? Because you got to be, if you do a tummy tuck, you can't be on your belly. So you got to be sitting up. You got to then try to create something that's going to allow you to do that, like a cutout in the mattress, what we call a zero gravity mattress or a zero gravity chair. And it's going to make your recovery very, very difficult and uncomfortable. And you're most likely going to be compromising your BBL results, because there's going to be some degree of pressure to the hips and the buttock during that time. And then number three, specifically here in Florida, when we do a tummy tuck, we're limited to how much fat we can remove via liposuction, which is only 1 liter, and that's it. And so that's typically not enough to like really contour the body, and really not enough in terms of the fat that we transfer to the buttock and hips. And so you're going to have a lesser result. So it's not worth it. You're gonna do something where you're gonna have a higher complication rate for a lesser result and compromised recovery. It makes no sense. So I recommend separating out the procedures. Do your tummy tuck first, and then come back 3 to 4 months later and do your BBL.
How do we know if we're a good candidate for a reverse tummy tuck?
So it depends where the loose skin or skin laxity is. If the loose skin is at or below the belly button, then you want a regular tummy tuck. If it's pretty tight down there, but the loose skin is above the belly button, then that's when you want your reverse tummy tuck. Now here's one important thing though. Typically when you do a reverse tummy tuck, you're not doing muscle repair. Muscle repair is not really a part of the reverse tummy tuck. So you have to have loose skin above the belly button and no need for muscle repair.
How long should I quit smoking cigarettes before booking a tummy tuck?
You want to quit at least 30 days before, okay? It takes at least 30 days for your body to clear out all the nicotine. And when I say stop, I mean completely stop. Don't even be around people that are smoking, okay? Because if that nicotine stays within your body and it's surgery day and you're positive for nicotine, your case will be canceled or postponed.
No gums?
No, nothing with nicotine, that's right. No nicotine gum, no nicotine, whatever, anything. Yeah, patches, no gums, no smoking. Nicotine cannot be in your system.
Okay, we have a lot of questions. Can you do breast implants with a tummy tuck?
Yeah, so breast implants with tummy tuck, that's what we sometimes call the mommy makeover. Very, very common. We do this day in, day out. So certainly a good combination. You can do any breast surgery combined with a tummy tuck we'll typically call that the mommy makeover.
Can you perform hernia repair with a tummy tuck?
Yes, so that's another great time to do your hernia repair. So typically you can't do a hernia repair. You don't do the hernia repair with Lipo 360 or BBL because it's not an open surgery. But with the tummy tuck, it's a great time to do it because you're basically making the incision, you're opening everything up, you have a direct view of that hernia, and you can fix it at that time, and then continue with your muscle repair and the rest of the tummy tuck.
Okay. This is a comment, not a question. I had my tummy tuck done in August 2024, and you completely changed my life. I'm obsessed with my results. You are the best.
That's awesome. Thank you so much. We love hearing those comments, so keep it coming.
Yes. So, do you recommend the tummy tuck first?
Yes. Always, always, always. Pretty much almost always. All right. If you are a candidate for a tummy tuck, meaning you have skin laxity, loose skin, or you have muscle weakness or muscle separation, and then you're going to need your tummy tuck and your Lipo 360 or BBL, I always recommend doing the tummy tuck first. Okay, so do your tummy tuck first, and then come back and do your Lipo 360 and BBL. Can they be done the other way around? It can, but it's not ideal. It's not ideal because doing a tummy tuck after makes it actually higher risk. The tummy tuck is a higher risk. The skin doesn't stretch down as much because it's been through some trauma, so it has inflammatory tissue and scar tissue. So it makes it tougher. It makes it less, so you can remove less skin. It's less smooth. It's just not ideal. So if you gotta do both, do your tummy tuck first and then come back and do your BBL.
Okay. How long do you have to wait to come back for the BBL and Lipo 360 after the tummy tuck?
So the soonest you come back would be 3 months. And then it could be, of course, any time after that. So you gotta wait at least 3 months.
Okay. And Doc, last question.
All right, last one.
Can I have an arm lift with my breast augmentation?
Yeah, definitely. So we can definitely do an arm lift at the time of the breast augmentation. We can even do an arm lift at the time of a mommy makeover. That's what we call the trifecta perfecta. So we can do breast, tummy, and arms all in one surgery, and we do that very, very, very efficiently here at Pure with some excellent results. You should check them out. All right? Okay, everybody. Well, I hope this was very, very helpful. Remember, this is where you want to be. This is where you want to be. Okay? As long as you check out all these boxes, you're going to be in this quadrant right here. All right? Yes, that's right. All right? So I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. I'll see you then. Take care, everyone. Ciao.
Okay.